In this video, we're going to demonstrate a counterstrain technique for posterior cervical tender point, a PC3 tender point. Now, clinically, the patient may present with some suboccipital headaches or earache, possibly tinnitus, and neck pain and somatic dysfunction of the cervical spine. So in our assessment, we're going to palpate along the midline. We're going to find the spinous process at C2 and relax, and then we're going to find just inferior to the spinous process at C2 would be the PC3 midline tender point. And we will press from inferior to superior and elicit the tender point response. We'll tell the patient to remember that, and we will quantify that as a 10. And the classic position to alleviate this PC3 midline tender point would require flexion to the point where you're involving the C3 segment. We reprobe or press to requantify. Hopefully the patient says it's a 0. If it's a 3 or a 2 or a 1, we still want to reposition and fine-tune to get to 0 or as close to 0 as possible. Once we get to 0, we're going to hold this position of flexion for 90 seconds. And after 90 seconds, we're going to slowly put the patient back to neutral and then repress or reprobe and requantify, and hopefully the patient says it's a 0 or at least 70% reduction of the original tenderness. Now, anatomically, this tender point may be associated with irritation of the greater and or the third occipital nerve. Also, maybe irritation or strain of muscles that are innervated by the C3 nerve root, such as the scalenes or the longus colli or the longus capitis. Now, you may also find a tender point on the inferior and lateral tip of that C2 spinous process that we will call a posterior C3 tender point, but it's off the inferior lateral tip of the spinous process. This would also require flexion, but also may require some fine-tuning in rotation and side bending away from the tender point. And then when we reprobe or repress to requantify, and hopefully when we started at a 10, hopefully now it's a 0. Again, holding for 90 seconds. And then after the 90 seconds, we return back to neutral, press to requantify, and hopefully, again, it's at least 70% reduction, but hopefully 100% reduction. So that's a posterior cervical PC3 tender point in the midline or in the inferior lateral tip of the spinous process of C2.